Hey Alpha Nurses, I'm Nurse Sandro from alphanurseguide.com. This is NCLEX PN Review Lesson 50, Neurological Medication Questions. You can get my study guides on Etsy. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
Question 1. The client with myasthenia gravis is receiving pyridostigmine. The nurse monitors for signs and symptoms of cholinergic crisis caused by overdose of the medication. The nurse checks the medication supply to ensure that which medication is available for administration if a cholinergic crisis occurs. A. Vitamin K. B. Acetylcysteine. C. Atropine sulfate. D. Protamine sulfate. The correct answer is C. Atropine sulfate. Rationale: the antidote for cholinergic crisis is atropine sulfate. Acetylcysteine is the antidote for acetaminophen. Vitamin K is the antidote for warfarin, and protamine sulfate is the antidote for heparin. Question 2. The nurse is caring for a client receiving morphine sulfate intravenously for pain. Because morphine sulfate has been prescribed for this client, which nursing action should be included in the plan of care? A. Encourage fluid intake. B. Monitor the client's temperature. C. Maintain the client in a supine position. D. Encourage the client to cough and deep breathe. The correct answer is D. Encourage the client to cough and deep breathe. Rationale: morphine sulfate suppresses the cough reflex. Clients need to be encouraged to cough and deep breathe to prevent pneumonia. The remaining options are not specifically associated with this medication. Question 3. Meperidine hydrochloride is prescribed for the client with pain. Which should the nurse monitor as a side effect of this medication? A. Diarrhea. B. Bradycardia. C. Hypertension. D. Urinary retention. The correct answer is D. Urinary retention. Rationale: meperidine hydrochloride is an opioid analgesic. Side effects of this medication include respiratory depression, orthostatic hypotension, tachycardia, drowsiness and mental clouding, constipation, and urinary retention. Question 4. Mannitol is being administered to a client with increased intracranial pressure following a head injury. The nurse assisting in caring for the client knows that which indicates the therapeutic action of this medication. A. Prevents the filtration of sodium and water through the kidneys. B. Prevents the filtration of sodium and potassium through the kidneys. C. Decreases water loss by promoting the reabsorption of sodium and water in the loop of Henle. D. Induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. The correct answer is D. Induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. Rationale: mannitol is an osmotic diuretic that induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. It is used to reduce intracranial pressure in the client with head trauma. Question 5. A healthcare provider initiates carbidopa-levodopa therapy for the client with Parkinson's disease. A few days after the client starts the medication, the client complains of nausea and vomiting. What should the nurse tell the client regarding how to avoid side effects when taking carbidopa-levodopa? A. Taking an antiemetic is the best measure to prevent the nausea. B. Taking the medication with food will help to prevent the nausea. C. This is an expected side effect of the medication and will decrease over time. D. The nausea and vomiting will decrease when the dose of levodopa is stabilized. The correct answer is B. Taking the medication with food will help to prevent the nausea. Rationale: if carbidopa-levodopa is causing nausea and vomiting, the nurse would tell the client that taking the medication with food will prevent the nausea. Additionally, the client should be instructed not to take the medication with a high-protein meal, because the high protein will affect absorption. Antiemetics from the phenothiazine class should not be used, because they block the therapeutic action of dopamine. Question 6. Neuroleptic malignant syndrome is suspected in a client who is taking chlorpromazine. Which medication should the nurse prepare in anticipation of the prescription to treat this adverse effect related to the use of chlorpromazine? A. Protamine sulfate. B. Bromocriptine. C. Phytonadione. D. Enalapril maleate. The correct answer is B. Bromocriptine. Rationale: bromocriptine is an anti-Parkinsonian prolactin inhibitor used in the treatment of neuroleptic malignant syndrome. Protamine sulfate is the antidote for heparin overdose. Vitamin K is the antidote for warfarin overdose. Enalapril maleate is an antihypertensive used in the treatment of hypertension. Question 7. A client is placed on chloral hydrate for short-term treatment. Which nursing action indicates an understanding of the major side effect of this medication? A. Monitoring neurological signs every 2 hours. B. Monitoring the blood pressure every 4 hours. C. Instructing the client to call for ambulation assistance. D. Lowering the bed and clearing a path to the bathroom at bedtime. The correct answer is C. Instructing the client to call for ambulation assistance. Rationale: chloral hydrate causes sedation and impairment of motor coordination, therefore, safety measures need to be implemented. The client is instructed to call for assistance with ambulation. Options A and B are not specifically associated with the use of this medication. Although option D is an appropriate nursing intervention, it is most important to instruct the client to call for assistance with ambulation. Question 8. A client with Parkinson's disease has been prescribed benztropine. The nurse monitors for which gastrointestinal side effect of this medication? A. Diarrhea. B. Dry mouth. C. Increased appetite. D. Hyperactive bowel sounds. The correct answer is B. Dry mouth. Rationale: common GI side effects of benztropine therapy include constipation and dry mouth. Other GI side effects include nausea and ileus. These effects are the result of the anticholinergic properties of the medication. Question 9. A hospitalized client is having the dosage of clonazepam adjusted. The nurse should plan to implement which action? A. Weighing the client daily. B. Observing for ecchymosis. C. Instituting seizure precautions. D. Monitoring blood glucose levels. The correct answer is C. Instituting seizure precautions. Rationale: clonazepam is a benzodiazepine used as an anticonvulsant. During initial therapy and during periods of dosage adjustment, the nurse should initiate seizure precautions for the client. Question 10. The nurse has given medication instructions to a client beginning anticonvulsant therapy with carbamazepine. The nurse determines that the client understands the use of the medication if the client knows to perform which activity? A. Use sunscreen when outside. B. Drive as long as it is not at night. C. Discontinue the medication if fever or sore throat occurs. D. Keep tissues handy because of excess salivation that may occur. The correct answer is A. Use sunscreen when outside. Rationale: carbamazepine acts by depressing synaptic transmission in the central nervous system. Because of this, the client should avoid driving or doing other activities that require mental alertness until the effect on the client is known. The client should use protective clothing and sunscreen to avoid photosensitivity reactions. The medication may cause dry mouth and not excessive salivation. The medication should not be abruptly discontinued because it could cause return of seizures or status epilepticus. Fever and sore throat should be reported to the healthcare provider. Question 11. A client with vascular headaches is taking ergotamine. Which client complaint should the nurse monitor? A. Constipation. B. Hypotension. C. Dependent edema. D. Cool, numb fingers and toes. The correct answer is D. Cool, numb fingers and toes. Rationale: ergotamine produces vasoconstriction, which suppresses vascular headaches, when given at a therapeutic dose range. The nurse monitors for hypertension, cool, numb fingers and toes, muscle pain, and nausea and vomiting. Question 12. The nurse is caring for a client with myasthenia gravis, who has received edrophonium intravenously to test for myasthenic crisis. The client asks the nurse how long the improvement in muscle strength will last. The nurse's response is based on the understanding that the duration is usually how many minutes? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 60 minutes. The correct answer is A. 5 minutes. Rationale: edrophonium may be given to test for myasthenic crisis. Most myasthenic clients show a significant improvement in muscle tone within 30 to 60 seconds after injection, and the muscle improvement lasts 4 to 5 minutes. Question 13. A client with narcolepsy has been prescribed a central nervous stimulant. The client complains to the nurse that he cannot sleep well anymore at night and does not want to take the medication any longer. Before making any specific comment, the nurse plans to investigate whether the client takes the medication, at which time schedule. A. After dinner each day. B. Just before going to bed. C. 2 hours before bedtime. D. At least 6 hours before bedtime. The correct answer is D. At least 6 hours before bedtime. Rationale: a central nervous system stimulant acts by releasing norepinephrine from nerve endings. The client should take the medication at least 6 hours before going to bed at night to prevent disturbances with sleep. Taking the medication at the time frames indicated in options A, B, and C will prevent the client from sleeping because of the stimulant properties of the medication. Question 14. A client is taking trihexyphenidyl for the treatment of Parkinson's disease. The nurse should monitor for which side effect of this medication? A. Diarrhea. B. Urinary retention. C. Urinary incontinence. D. Excessive perspiration. The correct answer is B. Urinary retention. Rationale: trihexyphenidyl is an anticholinergic medication. Because of this, it can cause urinary hesitancy and retention, constipation, dry mouth, and decreased sweating as side effects. Question 15. A client receiving therapy with carbidopa/levodopa is upset and tells the nurse that his urine has turned a darker color since he began to take the medication. The client wants to discontinue its use. In formulating a response to the client's concerns, how does the nurse interpret this development? A. Indicative of developing toxicity. B. A harmless side effect of the medication. C. A result of taking the medication with milk. D. A sign of interaction with another medication. The correct answer is B. A harmless side effect of the medication. Rationale: with carbidopa/levodopa therapy, a darkening of the urine or sweat may occur. The client should be reassured that this is a harmless effect of the medication and its use should be continued. Question 16. A client began taking amantadine approximately 2 weeks ago. Which decreased symptom should the nurse expect to see if the medication is having a therapeutic effect? A. Decreased voiding. B. Decreased blood pressure. C. Decreased rigidity and akinesia. D. Decreased white blood cell count. The correct answer is C. Decreased rigidity and akinesia. Rationale: amantadine is an anti-Parkinson agent that potentiates the action of dopamine in the central nervous system. The expected effect of therapy is a decrease in akinesia and rigidity. Leukopenia, urinary retention, and hypotension are all adverse effects of the medication. Question 17. A client is receiving anticonvulsant therapy with phenytoin. The nurse plans to monitor the results of which laboratory test closely? A. Serum sodium. B. Serum potassium. C. Blood urea nitrogen. D. Complete blood cell count. The correct answer is D. Complete blood cell count. Rationale: the nurse would monitor the client's complete blood cell counts because hematological side effects of this therapy include aplastic anemia, agranulocytosis, leukopenia, and thrombocytopenia. Other values that warrant monitoring include serum calcium levels and the results of urinalysis and hepatic and thyroid function tests. Question 18. The nurse is caring for a hospitalized child with a history of seizures who is receiving oral phenytoin sodium. Which should be included in the plan of care for this child? A. Monitoring intake and output. B. Providing oral hygiene, especially care of the gums. C. Administering medications 1 hour before food intake. D. Checking the heart rate before administering the phenytoin. The correct answer is B. Providing oral hygiene, especially care of the gums. Rationale: phenytoin sodium causes gum bleeding and hypertrophy, therefore, oral hygiene is important. Soft toothbrushes and gum massage should be instituted to reduce the risk of complications and prevent further trauma. Options A and D are incorrect because the intake and output, as well as heart rate, are not affected by this medication. Option C is incorrect because directions for administration of this medication include administering with food to minimize gastrointestinal upset. Question 19. A client is admitted to the hospital because of complaints of vomiting and abdominal pain. During data collection, the client tells the nurse that he is taking entacapone. Based on this finding, the nurse elicits information from the client regarding the presence of which condition? A. Hypertension. B. Hyperlipidemia. C. Parkinson's disease. D. Peripheral vascular disease. The correct answer is C. Parkinson's disease. Rationale: entacapone is an anti-Parkinsonian agent used in conjunction with levodopa to improve the quality of life in clients with Parkinson's disease. It is not used to treat cardiovascular disorders. Question 20. Carbidopa-levodopa is prescribed for a client with Parkinson's disease, and the nurse monitors the client for adverse effects of the medication. Which sign/symptom indicates that the client is experiencing an adverse effect? A. Pruritus. B. Tachycardia. C. Hypertension. D. Impaired voluntary movements. The correct answer is D. Impaired voluntary movements. Rationale: dyskinesia and impaired voluntary movement may occur with high levodopa dosages. Nausea, anorexia, dizziness, orthostatic hypotension, bradycardia, and akinesia are frequent side effects of the medication.